Welcome to the Medical Staff Voice Live. I'm Dr. Stan Frochtzwajg, Chief Medical Officer here at Community Memorial Health System. And I'm joined today by Dr. Jennifer Wan. Welcome, Dr. Wan. Nice to have you here.
Thank you.
Oh, you're very welcome. I know you are aware that we are going to be asking a few questions, so let me get started right away. Tell me a little bit about yourself. Where are you from? Where were you trained? What brought you to Ventura?
Well, I grew up in the Midwest. I actually grew up just outside Kansas City. And I came to Southern California when I was in high school. I actually graduated from Calabasas High School right down the street. I went to UC Berkeley for undergrad, and I went to USC for medical school. And after that, I did a general surgery residency at UCSF East Bay in the Bay Area. And I found out I loved taking care of patients with cancer and patients with complex problems that needed multidisciplinary care. But then I did realize I couldn't be a breast surgeon because I was a little bit bored by breast surgery and I loved the chest. So what I ended up choosing to do was become a thoracic surgical oncologist. I went to University of Michigan for my CT surgery fellowship, and I went there with the intention of treating lung and esophageal cancer.
Yes.
And then when I was there, I also found out that I unexpectedly loved heart surgery, but I went on my path. So my path was to take care of lung and esophageal cancer. I took a job at Kaiser in Northern California. I was there for 6 years before I was here, and I specialized in all general thoracic surgery with a focus on oncology. I did lung cancer, I did esophageal cancer. I co-founded and was the chair of a thoracic oncology tumor board, and that was my life for 6 years.
Wow. So you really went through a lot to get to where you are today.
Yeah, but then your question was, how did I get to Ventura?
Exactly.
Okay, so after I was in practice for about 5 years, I started looking around and thinking, what else do I want next? And my husband started complaining that he didn't like where we lived and he wanted to live closer to the ocean. So what happened next was we looked around at where else we could go, and I met Dr. Tedesco and Dr. Bushnell here in Ventura. And they were fantastic. I got along with them very well. I loved the location. But they really wanted somebody who they were excited about somebody who specialized in thoracic surgery and brought all those minimally invasive things, but they needed somebody who did cardiac surgery too. So it took us a while to come around to this, but I actually had a friend who I was bouncing ideas off of, and I said, there's this job, and it means going back to adult cardiac surgery. What do you think? Do you think that's crazy? He said, first of all, that's completely crazy. But then he said, actually, I can help you if that's really what you want. He happens to be the program director at Mayo Clinic for CT surgery.
God.
So I actually went and joined him. So I met with Dr. Tedesco and Dr. Bushnell, and we said, I think we can make this happen. And I actually went to Mayo Clinic for 5 months before I came here and just operated with my friend there and learned cardiac surgery again, or returned to cardiac surgery before I came here. And now I get to be here in Ventura doing a really nice, broad, beautiful CT surgery practice.
That's pretty ambitious and accomplished, I have to say. One does not hear that sort of dedication and ambition and such success. Well, I appreciate knowing that because I know you and I did not know all those details.
Okay, well, there you go.
Well, let's delve down into some more details, maybe a few more specifics, maybe a little bit of what we talked about before we actually got started. What can we offer our community, our patients, and what can our physicians know that you do that often get referred to tertiary care centers that perhaps don't need to be referred?
Right. So I came from a practice where I was the tertiary referral, especially for thoracic tumors, esophageal cancer, and foregut surgery. I had a high volume of esophageal cancer and esophagectomies. I did a lot of cases where achalasia, giant paraesophageal hernias where the whole stomach's in the chest, and different kinds of complex foregut surgery. And I think we can offer that here now. And I will also say we can offer the entire full range of every type of minimally invasive tumor mass workup that is available at any tertiary center. We can bring that here, and we're doing that here now.
Wow.
So on the thoracic side, I think that's what we have to offer. We really do the whole range of thoracic tumors, thoracic oncology, and we've brought it all to Community Memorial. We can do it all here now, and I think we do it with the same quality that I did those cases at a tertiary center.
Well, you really answered part of my second question, which is what kinds of conditions do you like to treat? And you clearly love to treat the things you just described.
Yeah, I do. But I will, let me revisit the cardiac surgery too for you.
Please, I appreciate it.
So I will tell you that I unexpectedly rediscovered cardiac surgery and loved it. And I've had a renaissance or renewal since I've arrived in Ventura, because I've really explored that side of cardiothoracic surgery, and I think become great at it. And I feel like I brought a lot of contemporary new ideas in cardiac surgery, and we're just trying to build on those. For example, I've been a big part of starting the TAVR, the transcatheter aortic valve replacement program, which is done by both an interventional cardiologist and a cardiac surgeon together. So that has been just a huge part of my time here, and I've loved working with the cardiology team here in developing that. So I feel like that's been a huge achievement. And we are really becoming much more contemporary in the cardiac surgery we practice. We've updated a lot of, Dr. Bushnell and I have really devoted ourselves to updating our practice to be completely modern. And I think we can offer all modern techniques in coronary artery bypass grafting, so treating coronary artery disease, and also in valvular disease, in treating aortic and mitral valve disease especially. And I think you'll see much more to come in that area.
So I heard that we've gotten to 50 TAVR cases last year.
Actually, we just reached a little over 120.
Wow, even more impressive. Thank you so much. Where is your practice located for our physicians?
Okay, so my practice is called California Cardiovascular and Thoracic Surgeons. It's located in the medical office building right across the street from Community Memorial Hospital, and you can call us directly there. If you search for me, you might see that I also see patients at Anacapa by Ventura County Medical Center. So don't get confused by that. My primary practice is right across the street at Community Memorial Hospital, and you should call that number.
Well, to lighten things up a little bit, do you have outside interests, hobbies other than medicine?
Yeah, well, I love to travel. I like to hike. I like to be outside. Traveling has been a little bit tamped down lately, but we're still trying to get out. But my husband and I have been to 60 countries.
Wow.
My son, who's 13, has been to 39 countries. So we do try to get out there a little bit. We love being by the ocean, and we love hiking. And since all this pandemic quarantine business, I've taken up gardening.
Good for you. Yeah. We're gardeners as well,
Yeah.
and we know that's very healthy for all of us. Vitamin D, hands in the earth.
Yeah.
Very nice. Well, we're going to lighten it up one more stage,
Okay.
and that is we call this segment This or That.
Okay.
Simple answers.
Okay. I'm so excited.
Are you early or late?
I'm definitely late. I can't believe that I'm not an earlier riser at all, even though I'm a surgeon. It's not a good match, actually.
Believe it. Pepsi or Coke?
Coke.
Wow. Office day or surgery day? This is a fun one.
This is an easy answer. I do like talking to people, but surgery day.
Good for you. That sounds like a surgeon.
Yeah.
Crevette or Maserati?
Oh, Maserati.
Oh, very good.
Definitely Maserati. Okay.
Christmas or Thanksgiving?
Ooh, that's difficult. I like Thanksgiving.
Good. Beach getaway or European backpacking?
Ideally, European backpacking that also includes a beach.
Nice combo. I like that. And Batman or Superman?
Batman. A little darker.
Very good. Hamburger or taco?
Taco. Fish taco.
We've got a lot of insight into you now. Snapper, no, I can't say it. Anyways, thank you for tuning in to learn more about Dr. Jennifer Wan. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org and be sure to like and subscribe for more from your community health system. Thank you. Thank you.
Thanks, Dan.
You're so welcome.